Hello, everyone. This week we're going to be covering the urinary and renal systems. We're going to start this week with assessment of the renal and urinary systems. This week's is mostly on the urinary system. We get into renal disease next week. Um, Even though the syllabus does say that we are not going to cover urinary assessment in class, I am going to do just a brief overview of the urinary system to make sure that we are on track of what all we need to look at. I hope that makes sense. So this is the assessment of the urinary system, and make sure that you look at the diagnostic test starting on page 1331. But I'm just going to give you a kind of a brief overview of the urinary system as we start our lecture process today. I think it's important just to kind of take a minute or two just to kind of look at it and make sure that we know what we're um, in for the next 2 weeks. So do sure you take time to look at the urinary bladder. Make sure that you're familiar with both the external sphincter muscles. Make sure that you're familiar with um, looking at the bladder muscle itself, and make sure that you're familiar with where the location of the prostate is in the male patient. We are going to be taking a look at the changes on both the kidneys and the urinary systems that are a result of aging. Remember, with this semester being about chronic disease, sometimes we are dealing with an older population. And because of that older population, we need to know what is normal for the aging process and what can be because of disease. There are several changes related to aging in the renal system, and they are listed very nicely on chapter 65:1, nursing focus on the older adult. So make sure you look at the fact that as we age, we have a decreased glomerular filtration rate. Also, look at the nocturia so that we can look at reasons why patients have incontinence, which we'll talk about a little bit more in the next chapter. But it's very important when dealing with our elderly patients that we try to accommodate them in the hospital so that they aren't trying to get up to go to the bathroom and end up falling. Also, patients who are elderly have a decreased bladder capacity. They can have Winkin urinary sphincters, and that also shortens the urethra shortens in females. There also can be a problem with urinary retention as well. So that again is on chart 65:1. When we're talking about nursing focus of the older adult. You're going to need to look on your own at the anatomy and physiology of both the urinary and renal systems. Make sure you're familiar with that on your own. Make sure that you're familiar with the structures of the kidneys and the pathophysiology of the kidneys and the renal system. These are just more slides to help you with that, going over the A&P and the patho of the kidneys. So we're going to be taking a short time to look at the physical assessment of the patient with urinary and kidney problems here in just a few minutes, and we'll start up with that. When you're taking a history and physical on a patient who has either renal or urinary issues, you want to make sure that you're taking not only a detailed history, but taking a chance to listen to them about their concerns. And you may have to listen to the fact that they may be blowing off their incontinence issues because they feel like it's just a rite of passage. Perhaps it's a female who's had a lot of children, or it's an elderly gentleman who has prostate issues. But we need to be aware, give them the opportunity to voice their concerns so that we might be able to help them with medications or with physical therapy. So it's important to give the patient a chance to speak when you're doing that initial interview about their H&P. It's very important, especially when you're talking about something as delicate as the urinary system, that you take time to listen to what the patients may call um, voiding or urination. Sometimes they use words like making water or things like that. So you want to make sure that you're familiar with the customs of areas that you work in so that you can kind of understand what they're saying. And if not, it's okay to pause and say, okay, can you explain that to me just a little bit more? It's also important to realize that some patients, it's can be a knowledge deficit. It may be that they don't know how to um, wipe their bottom correctly, and they may be getting stool up into their urinary tract, causing frequent urinary tract infections. Um, a lot of times it's knowledge deficit. They think that just because they're at a certain age that it's okay, and that these are problems that they're supposed to have at this age. So it's very important for us to give these people a chance to speak and listen to them about what their concerns are when it comes to their urinary health. And of course, like we do with any assessment, we want to make sure that we look at their nutritional history, especially if they're presenting with frequent renal calculi. Perhaps they ingest large amounts of protein or they have poor fluid intake. These can cause new kidney stones. It can also, maybe they don't drink enough water or they things like that can also be a factor. We also need to look at their medical history, and we also want to make sure that we're looking, do they have hypertension? Are they using a lot of over-the-counter medications? What is their family history? Do they have a family history of any kidney diseases or urinary problems? Do they have a history of kidney stones in their family? And what brings them in today? What type of kidney issues are we having issues with? A lot of times, especially when dealing with um, patients, I'll go ahead and just ask about urinary patterns, whether or not they have any incontinence issues or nocturia where they have frequent urinary need to urinate at night, or urgency where they have an inability to stop their urination flow. You're going to want to make sure that you look over the physical assessment for your patient with renal and urinary issues. On page 1331, you'll see a cultural box. It's talking about female circumcision, but that's not the only reason that there can be alterations to women. It can also be from cancers, if they have vulvar cancer. Um, Sometimes there has been labia removed. So you want to ask these questions so that you're familiar with um, what your patient is dealing with. And if they are from a culture where they have had female circumcision, they can have a lot of trouble with inability to either hold their urine or completely empty their bladder. Sometimes the urethra is very small, and they have lots of issues with getting a lot of urinary tract infections and also with being able to control their urine output. Next, we want to make sure that we look at the diagnostic tests for both the urinary and renal systems. Starting on page 1331 in your book, it talks about different blood tests. I definitely want to make sure that you know about blood urea nitrogen and what it is, and also what your serum creatinine, when it is elevated, what that can be caused from. Also, make sure you take the time to look at the urine tests, such as urinalysis. Make sure you're familiar with what causes a high specific gravity, low specific gravities. You also want to make sure that you're familiar with urine pH, and that remember that protein is not normally present in the urine. And that's something we need to make sure that we're aware of. These are things that I want to make sure that you do look at while you're covering this on your own. Things I want you to look for with as far as other testing. Make sure you're familiar with when you would use a bladder scanner. I've moved on to page 1336 at this point, and the reasons that would be done. We also want to make sure that we're looking at different imaging tests that are sometimes completed with these patients, and that's on in table 65.4 and 65.5. Both of these are important for us to make sure that we're looking at as well. With the cystoscopy, that's also sometimes just called a cysto. I really just want you to make sure that you're familiar with what it's for, and that it identifies abnormalities in the bladder wall, urethra, and urinary occlusions. Sometimes it treats small occlusions or lesions during that procedure, or the removal of a stones in a basket. They kind of like will go in and blast them out. That's really what I want you to know about cystos, and that sometimes these patients will have pink tinged urine afterwards. So that's the main thing, is just knowing what that test is. All right, so again, these are just other procedures that are sometimes done on patients who are having kidney issues. Not as concerned about those as there was the other ones that we've already kind of talked about. So make sure you just do a brief overview of the chapter to make sure that you're familiar with what you need to know, and make sure that on the things that I did talk about that you have looked at those more, as far as like what blood urea nitrogen is, what your normal creatinines are, what it means when it's elevated. You want to make sure that you're familiar with the signs of aging on the urinary tract system and on the renal system. So we want to make sure that we know and have looked at all of those as well. All right, so that's the down and dirty on chapter 65. Remember, this is all of a review, so you should already have this information, but I did want to take the time to go over it briefly with you. I hope it helped.